Hi, I'm Rosa with BeWellPBC. The Palm Health Foundation, Healthier Together Communities, and my fellow community connectors recently invited two local physicians, Dr. Michael Smith and Dr. Tiffany McCalla from the Leroy Jefferson Medical Society, to join us for a couch conversation to talk about COVID-19. We appreciate the doctors giving us straight talk about COVID-19 and how we can stay safe. This is third in a series of 4 videos discussing what you need to know about COVID-19. In this video, you will learn more about facts, myths, and straight talk about COVID-19. Get ready to learn more about COVID-19 and be sure to watch the other videos in the series. You can find the series on BeWellPBC or Palm Health YouTube channel.
What's the new strand of COVID all about, and how dangerous is it?
Well, it's not a new strain. There are at least 3 strains that we know about, and there are more than likely more that we don't know about, to be honest with you, because as we explained to you earlier, that's what viruses do. They mutate. That's when they mutate into another, that's called a new strain. Now, the good news is that the change is usually subtle, okay? The change is subtle because remember, the virus is trying to acclimate itself to the new environment. So it changes a little bit. And so the vaccines are still proving effective against even these different strains. In order for a vaccine that was developed for a particular disease is rendered ineffective, the virus would have to undergo significant change, like almost becoming something totally different, all right? So the changes in the different strains that scares people, oh my gosh, the vaccines have shown to still be effective. It may require some people may require a booster shot if they contract one of the different strains. But the new strains, the UK variant, the Brazilian variant, and the South African variant, they are highly transmissible, meaning that you can catch it easier than the original virus that came out of Wuhan, China. So, that's why it's so important. That was the whole point about if these new strains are more transmissible, that's why you don't need to be out in the streets having your brunch and going to party and stuff. Okay, you around there laughing and playing and doing the line dance or doing whatever it is, and you breathe in and laugh and you breathe in all that COVID-19.
We don't do that anymore. We just eat. We don't do that anymore.
Oh yes, you do. Yes, you do. I see it. I see it on social media. Yes, you do. I see it. So, and I try to tell my people, okay, you can play with the devil all day long, but he'll play with you too.
There are many assumptions in the Black community about the vaccine, particularly in the Haitian community. This is due to lack of knowledge and education about when they started to develop the vaccines. Is there any type of community education coming up for these communities to remove the stigma?
Independent doctors and scientists, in different communities are just, giving talks and discussions like this to dispel some of the myths. Some of these beliefs are rooted in culture. Some of them are rooted in religion. There's a lot of different stuff out there. And that's why, I try to keep things really basic and simple, because sometimes you add too much information, all it does is cloud, an already cloudy mind. So I try to avoid discussions about religion. I mean, I've been invited by church groups to give talks on COVID-19 and so forth. Those who know me know that I'm a man of faith, but my faith travels down one road and my science travels down another road right parallel to it. They don't conflict, okay? So when I talk about COVID-19, I speak about the science, okay? And I try to avoid, beliefs because beliefs are just that, okay? Even in a church, you have different beliefs, okay? Everybody in a congregation is not of the same mindset on all things. So trust me on that. But so I try to avoid issues on just beliefs, and we stick with the science, and we try to deliver the message of the facts, the science, and I avoid those things that are not in the realm of facts and science. And I allow people to develop their own ideas based on those other beliefs and so forth. But there are different groups trying their best to dispel the myths and beliefs out there.
Someone brought up about blue tongue you get from maybe COVID symptoms. I don't know if that was, we wanted to know if that was fact or myth, or is it like what weird symptoms I have seen like people with a corona tongue, and how does like that work? So is that like the blue tongue? They said it was so long. I heard about it. I'm just bringing up the fact and myth. That was Rosa though.
It was me. I saw it on TV.
That was Rosa. That's what I'm saying.
The tongue was, yes.
Well, I don't know if any, I'm not familiar, okay, with any blue tongue or so forth. I would have to consult with some of my, colleagues on that. I'm not familiar with that. I can say that different illnesses can elicit some very strange physical developments that are very weird looking. I don't know if that is the case here. I'm not familiar, so I'm not gonna follow that, follow down that rabbit hole. I don't know if that's true or not. I would have to consult.
I'm a firm believer in wearing a mask. Dr. Fauci is saying now we should double up because of the new variants. So 1 or 2.
You can wear 2 masks. You can get, if you're able to get an N95 mask that stops up to 95% of particulate matter. I mean, the main thing is to get a mask that fits well around the bridge of your nose and the size of your face, and make sure it fits you. Sometimes I see these big men wearing these little tiny masks. I'm like, dude, what made you think that was okay? Get a mask that fits you and keep it over your nose, all right? When I see people wearing a mask under their nose, I stay away. Well, one, I don't go out very much. I primarily go to Publix, Walmart, the gas station. I get back home and I do it quick as possible, okay? I have my home office here, but I don't go hanging out, but when I see people with that, no. So it wouldn't hurt to double up, okay? Just to add a little extra protection, but make sure you're covered and that it's a well-fitted mask.
So I usually give the evil eye to parents when they're all masked up and the kids are no mask. So infants and toddlers, mask or no mask?
Absolutely, the child should be masked. I give them the evil eye too.
I'm like, what is it?
Yes, I don't listen. I don't understand that. I don't understand that. All I can do is pray for the child. Children have the current research shows that children are less likely to develop the disease. They are more likely to transmit the virus and to older people, and they develop the disease. So children need to be protected just like adults. So I have no answer as to why, folks will, I saw that the other day, this guy was in the supermarket, with his mask on, and he had the little baby in the chest carrier with no mask on. And I'm saying, I don't know your personal situation. I'm thinking in my head, I don't know your personal situation, but I don't know if this is your personal time with your baby, but you should let that child at home if you can't put on a mask, so so to answer your question, put the mask on your children. The fact that I have to say that is incredible because usually the most instinctive thing for an adult, for a parent to do is to protect their child or to be overly protective. So the fact that needs to be said is incredible to me, but yes, put the mask on your children and keep your children away from strangers.
Thank you. It needed to be said.
I know this stuff is, sounds very complicated sometimes, that's why, I try to caution people about listening to too much on social media, you know, and jumping on stuff that you don't fully understand, because it's, you know, science is not simple. You know, people don't spend years and years studying this stuff. You know, we may spit it out, you know, like it's, but it takes a lot to understand this stuff. But if you can, you know, what Dr. McCalla just said, if you could just kind of remember, you know, just when you go in and get your flu shot, you know, they ask you, you know, are you sick? You know, so there are certain medications, certain pharmaceuticals that are only indicated for a short window or a period. And once you cross a certain threshold, then you're no longer eligible. But these are therapies, okay? These are therapies intended to prevent, you know, the onset, you know, of the disease, because I've told people, even with the flu virus, the flu vaccination, get it, okay? You know, like, well, what about the people who get the flu shot and they still develop flu? Yeah, they probably do still develop the flu, but guess what? It's not as bad as it would have been had they not received it at all. So, you know, the body, you know, how much protection it's almost impossible to determine what percentage of protection this person will have versus that person. I mean, that's almost, we don't have that kind of technology. Maybe the time will come when a person can walk through a machine like, you know, like those things they have at the airport, and it'll swivel around your body and it can tell you every single thing about you. We're not there yet. But, you know, it's just important to, that's why I told you, it's important to consult with your primary care physician and allow them to provide you with information on the available therapies and what is best for you, okay? I know that we're all concerned and scared about this and that, but just relax and just, you know, listen to programs like this, consult with your primary care physician, be patient, protect yourself. I mean, understand this, folks, we are talking about all this modern science, okay? All this modern technology and drugs and so forth. But you know what? It really does come down to some really basic common sense, okay? Stay home, stay away from people, and protect yourself. I mean, you know, during the Middle Ages, when they heard about a village had the plague, common sense, you stay away, okay? If someone's around you and they break wind, you go away, okay? I mean, it's not hard science. I mean, I know I go away. I don't stay there, you know, I leave. So if someone has something, a germ, you know, even if someone smells bad or sneezes, I leave that area, okay? So why would you stay there? Okay, so if people have infection, stay away, stay yourself home, protect yourself, and ask God to give you the patience for us to get on the other side of this pandemic. And what I mean by other side, I resist saying when the pandemic is over, because we don't really know what the future holds, but I say on the other side of the pandemic, that means that when we get the number of cases and the number of deaths down to what we call baseline, okay, to a point where public health can manage it, okay, like we managed other epidemics, okay, because understand this, something starts out as a pandemic, as an epidemic, then it escalates to a pandemic when it goes beyond a country's borders or it goes to other nations. That's when it becomes a pandemic. Most infections are epidemics on a smaller level, you know, maybe a community, you know, or so. So once we get things down to baseline, okay, to where public health can properly manage it, and we've got enough of the population vaccinated, that is what I consider to be the other side of the pandemic, okay? But you don't need all this modern technology to understand what to do, what you individually can do. You individually have the power to stay away from other people. It's just that adults are just as hard-headed as young people. They want to go out with their friends. They want to go have their, you know, brunch. They want to go have their night at the club. Okay, well, you have free will. You have free choice, you know, and I'm just going to tell you what not to do. Now, what you choose to do between you and your God.
Thank you for joining us for Let's Talk COVID-19. For more information, please be sure to watch the other videos in the series and visit the Leroy Jefferson Medical Society's website.